All right, Yuri, so it's your first day on 290-200. So I thought what we might do is go through how I do a chart review, so I can show you. All right, so here's our new patient, right? So I've opened up his chart. So the first thing I do is I go to the chart review tab. And in the chart review tab, I am looking for red, right? So ED visits and hospital admissions are red. So that gives me an immediate sense of how frequently the patient is using hospital services. So I'm looking at this here. I see we came to the ED a few days ago, and I'm seeing then a prior admission in June. And I'm seeing an ED visit in May, and then January. It's the last one before that.
Mm-hmm.
So not someone who's in the hospital all that often, right? So then I'll usually look at and read, or pull up the most recent discharge summary to read. And I'm paying attention to the dates first, because it gives me a sense, how long was this person in the hospital? Are we talking about a week, or are we talking about somebody who gets so ill they need to be here for months? Then I'm looking over to the right side, medication listed discharge. So I'm curious about how long they're in the hospital and then what medicines they left with, right? That generally, just looking at that alone, gives me a sense of what the condition is, what the diagnosis might be. This is without actually even starting to read anything. I'm just looking at dates, how long they're in the hospital, what their meds are. Then, in terms of the actual content of the discharge summary, I'll generally skim through the first few paragraphs to see what the presentation was like in CPEP and what sorts of symptoms they had, and then what the discharge diagnosis was. But I'm not necessarily reading that word for word. I'm just kind of skimming through to get a sense of things. So at that point, if there's multiple prior hospitalizations, I might read through kind of in a similar way, the discharge summary immediately prior to that one, and then maybe prior to that one. But I'm paying the most attention definitely to the most recent discharge summary. From that point, then I'm going into the Notes tab, which will bring me to the current CPEP encounter, right? So I want to go back, and for the notes for the current encounter, I at least read all the notes, not just the clinical evaluator or physician notes. So I'll go back and pull up the medical ED note. And the reason why I read all the notes is I really want to know how the patient's presenting to different people, what the patient's saying to different people, and what the complaint looks like kind of over time in CPEP.
Mm-hmm.
So I'll look at the ED note and see, what did the medical provider have to say about the patient? What did the triage nurse and the ED write in their note? That's generally all that's really in the medical ED notes. Then the person who's arriving in CPEP. Once they're in CPEP, I'm looking at the RN triage note. What did they tell the initial RN in CPEP who did the triage? From there, I'm looking through at each RN note and seeing, okay, what are the observations that the nurses are having about the patient in the milieu? What are they doing? How are they behaving? Then next, I'm looking at clinical evaluator note. That usually is going to contain more clinical info about presenting symptoms, collateral information that was contacted. Next, we're getting to the actual psychiatrist note. And that's what I'm looking at pretty much for the notes. So an important part of that is looking at what did each discipline observe about the patient. Nursing, clinical evaluator, and psychiatrist. So I don't just read the psychiatrist note, because that frequently will miss all the content regarding how's the patient doing in the milieu, which is important. Any significant event notes would be highlighting restraint seclusion, so I'll pay special attention to those. From there, I go to the Manage Orders tab and look through the medicines, paying special attention to the psychiatric medications. So this tells me what was ordered on admission from CPEP. Right, so again, I'm looking at this chart, I see, okay, the person was started on olanzapine, they have PRNs ordered for Haldol, oral, injectables, and kind of a mix of PRNs that I don't necessarily care too much about. From there, I go back to the Summary tab, And then I look at the MAR, medication administration record, and I want to know, is the patient taking the medications that were prescribed in CPAP? Right, so I'm looking through the MAR. I'm seeing, okay, so despite being ordered olanzapine, the patient's not taking olanzapine.
Mm-hmm.
And then this also would tell me if any one-time orders for any meds, either PRNs or IMs, were ordered. The MAR will tell you that. So those are the few things that I look at to do the initial chart review. Chart review tab, ED visits, most recent discharge summary, notes tab, go through all the CPAP notes, manage orders, what are the current orders for medications, and then the MAR, is the patient taking medications? And those are the main things. So if that's, all you have time to look at, that should be adequate for most new patient rounds.
Awesome. Thank you.
Sure. Any questions?